You know, in cardiology fraternity, the blockage is a big business. Coronary arteries are very small, overlapping the heart, and that is 4 millimeter and going down towards apex 2.6 millimeter. And that is flexible. When heart contracts, it contracts, and heart relax, it relax. But when you have once chest pain, you suddenly rush to hospital. And there is a compulsion in hospital that angiography तो करना ही पड़ेगा. Then you go for angiography. और एंजियोग्राफी में अल्ट्रासाउंड नहीं डालते हैं. फिर आपको एक ग्राफ होता है, उस पर 90%, 80%, 100%, 99%, 70% ऐसे ब्लॉकेज बता देते हैं. बट रिमेंबर, साइंस से दैट मोर blockage is big, then that is stable. Rarely it rupture. लेकिन आपको बाईपास करा लो, स्टेंटिंग डलवा दो, ऐसा बहुत प्रेशर आता है हॉस्पिटल में से, बिकॉज दे हैव टू रन द ऑर्गेनाइजेशन. बट इफ यू हैव नो चेस्ट पेन, after once chest pain occur, then no chest pain, no breathlessness, if you are not on oxygen supply or not on ventilator, then you have nothing to worry. First, you can ask doctor, doctor, I want to see the inflammation in the artery. I am not believing in the blockage. Give me black print of the angiography, black print of the angiography, and take cassette also, CD also. But you tell doctor that, doctor, I want to see the inflammation in the artery by my blood test, and do echocardiogram. But due to Ayushman Yojana, the free surgery is available, stenting is available, so people happily do that surgical procedure that is traumatic. Once a while it reblockages, but people don't understand. अपने पैसा बचते हैं ना, that is their aim. But recent trials, lot of trials, courage, ischemia, reversal, suggest that in spite of crucial 6 hours of heart attack or acute coronary syndrome, you should not go for this angioplasty or stenting or bypass. You can medically treat it better than this invasive procedure. Bypass is a very old process, and bypass weaken the heart because of ischemic reperfusion injury and cardioplegia. It weakens the heart. Angioplasty in stable condition, जैसे आपको हार्ट अटैक या छोटा हार्ट अटैक ACS आया, आपने स्टेंट डलवा दिया 6 कलाक में. मैक्सिमम टाइम लिमिट तो 90 मिनट्स की है, लेकिन विंडो एक्सटेंड करके 6 कलाक की मैं बात कर रहा हूँ. देन आफ्टर 1 week, 10 days, if you put stent by showing severe blockages, doctor has shown that is not working. You have to reduce the inflammation, bad cholesterol, bad lipoprotein small a, apolipo B, by authentic certified medicines. And if you have no proximal LMCA lesion over 50% or 70% LMC lesion, proximal, then don't go for bypass. Because bypass doesn't pick up the blockage. It just bypass from one artery, taking from the another part of the body, either internal memory or radial artery or saphenous vein, reversing. And they do stitching above blockage and stitching below blockage. So blockage becomes sedentary. It has no value. Meanwhile, same thing happens in medical treatment with clinical trial approved medical treatment. And FDA approved EECP treatment by certified doctor, and diet control and meditation, yoga, pranayama and walking habit that we explain you when you personally visit. Basically, mostly heart disease occurs due to processed food, sugary food, cold drinks, high saturated fat, sedentary lifestyle, stress, late night dinner is the biggest factor, late night sleep, interruption in sleep that disturb the circadian rhythm and increase stress hormones. And one thing you realize that after angiography showing you heavy percentage and you become panicky. But they don't test your inflammatory marker. They don't test your vitamin B12, D3, uric acid or anti-pro-BNP, heart weak है कि strong है. They don't. If you have diabetes, never go for surgical intervention or stenting. In spite 90 minutes or maximum 6 hours window period emergency. Otherwise, you will be surprised that you have done wrong decision. So take decision wisely. If you have no pain currently, after first time pain, if you have no breathlessness, breathing problem, if you have no oxygen and if you are not on ventilator, nothing to worry. If your pumping is less, never go for bypass. If you are diabetic or kidney disease, never go for surgical bypass or stenting. Take certified clinical trial approved heart medicines as we prescribe and certified EECP treatment by certified EECP trained specialist. Stent doctor, DM cannot do treatment of EECP because EECP is very deep-rooted science and it is better than bypass and stenting. Thank you.